Cynthia's here to see you, Grandma.
My name is Cynthia.
Hi, Ms. Petrovic. How you doing today?
I'm an RN. I'm with BJC Home Care Services. As a home care RN, I service the immediate St. Louis City area. All types of patients, directly from surgery, patients that need different types of teaching, i.e. diabetic teaching. There could be some type of GI feeding that they may need. They may need teaching on that after a procedure.
Ms. Petrovic, I'm just going to get your vital signs.
I do go in the patient's home and I work with them in their home, and I also work closely with the family because they're going to need to know what to do when we're not there. So they're going to need lots of teaching and support. I think support is the main thing, because when they leave the hospital, they may have limited knowledge as to what they're going to be doing at home, and so they need to feel comfortable with doing procedures in the home.
I'm going to get your blood pressure also, okay?
The greatest advantage of the nurse coming in the home, especially, say, for instance, after knee surgery. Once they've had knee surgery, it's difficult to get in and out of the home. You know, they have steps to conquer, and so they need physical therapy, and that takes time. And so if we have to monitor their INRs, which a lot of times they're put on Coumadin, which is a medication to thin the blood so that they don't come up with a clot, we have to come in and monitor those levels. So if we weren't coming, they would have to leave the home. Sometimes the patient has not just the nurse, but the patient could have a physical therapist, a social worker, a occupational therapist, or a speech therapist. So there's a team, and a lot of times we do what we call case conferencing. So we call each other and we discuss the patient and what's going on with the patient. If there's something untoward going on with the patient, sometimes I'll get calls from physical therapists. So we work together. I get to know my patients really well. The families, they get used to me coming, and it becomes very difficult when it's time to discharge. And being that I'm very busy, it's hard for me to go back all the time and see them like I would like to. But, you know, when I'm passing different streets in the city, you know, I say, oh, I wonder how Mrs. So-and-so is doing. I wonder how Mr. So-and-so is doing. So I do miss them. And I occasionally get calls back, you know, to see how I'm doing. They're checking on me.
It was good seeing you, and thank you for having me. And I'll call and make some visits for you next week, okay?
What I like most about going in the home, the relationships with family and the patient, just being in the home with the dogs and the kids and grandma and grandpa, and just seeing how everyone's home life is different. I enjoy that, and I connect with the people. I think that's what I enjoy the most.